My name is Dr. Jose Lopez. I'm a fellow of the American College of Surgeons, and I work for Tampa General Hospital right here in Tampa Bay, Davis Island. I was born and raised in Puerto Rico, and I went to medical school in Ponce School of Medicine, which is in the south part of the island of Puerto Rico. From 1998 to 2003, I came here, Tampa General Hospital, USF surgery program, became a resident, and then from 2003 to 2004, did a fellowship in colon and rectal surgery. Growing up, a lot of people say, oh, I wanted to be a doctor. I did. I was one of those kids that early on I said I want to be a physician. Why a physician? I don't know. Maybe because you're going to change people's lives. Growing up, I grew up with two cousins that had cerebral palsy, so I was very involved with them. Sorry if I get a little emotional, but they passed when they were very young. But during that time, I was able to spend a lot of time with them, feeding them, cleaning their G and J tubes, tracheostomies, etc. And unfortunately, they passed when they were young, but I learned a lot hands-on, how to do things, etc. So going to medical school was like second nature. I knew I wanted to help people. I knew I wanted to care for people, and becoming a doctor was probably my dream at the time, and it came true one day. I think the best part of my day is actually waking up and knowing that I'm going to help people, no matter if it's in the operating room or if it's just doing a consultation online or face-to-face. There are many times that patients come in confused as to what they should do. And they always ask me, what would you do? My answer is always, well, if you were my mom, if you were my wife, if you were my brother, it's very easy to do that and say that. And they can relate to that. They understand when you speak that language. They're able to say, thank you for telling me the truth, or, for giving me like it is and not trying to hide anything. And I always say, I'm not here to sell operations. I'm a surgeon. I'm not here to sell you a procedure. I'm here to give you information that you can make the best decision for yourself and your family. So one of the best parts of working at Tampa General Hospital is not only that I know the place, because I train here, seeing how now we have multiple subspecialties all within one roof. Patient can't come here and never have to leave for their care anywhere else, because everything that you need is right here at Tampa General Hospital. The services that we provide are essentially mostly thyroid and parathyroid, but anything that has to do with your parathyroids, which include a parathyroid cyst, a parathyroid adenoma, secondary hyperparathyroidism, which is usually renal patients, tertiary hyperparathyroidism, where renal patients that now underwent a transplant and need their parathyroids resected because their hormone levels or calcium levels are still elevated. So anything that had with parathyroid expertise, we're able to deliver. Reoperations, failed operations somewhere else, anything that has to do with your parathyroid glands, which control your calcium, is what we specialize on. So if your calcium is high, most likely you have a parathyroid tumor, and we're the people that you want to come and see so we can care for that.